I'm Muzaffar Qazilbash. I work in the Department of Stem Cell Transplantation at MD Anderson Cancer Center in Houston. And today I'm going to talk about a clinical trial that we presented at this American Society of Hematology meeting. So as I mentioned, I am in the Department of Stem Cell Transplantation. So this trial that we did was a phase 3 randomized trial comparing two different preparative regimens. That's the chemotherapy that we give before autologous stem cell transplantation to our patients. And traditionally, Melphalan as a single agent is used as a conditioning regimen for transplant. There are studies that showed that combination of two drugs, Busulfan and Melphalan, may improve the outcome in these patients. So we designed a study where we compared these two conditioning regimens, Melphalan against Busulfan plus Melphalan. So we treated about 204 patients in this trial, pretty evenly matched up to age 70. They were all newly diagnosed myelomas. They all received their induction treatment, mostly at MD Anderson, and almost all of them received their induction with a triplet, either VRD or VCD. And then they went on to receive transplant. About 30% of patients had high-risk chromosomal abnormalities in both arms. And then they went on to be randomized either to Melphalan arm or Busulfan plus Melphalan arm. And then, as we see at MD Anderson, about 85% of them went on to get maintenance treatment, mostly with lenalidomide alone, but we do have some ongoing clinical trials where they got lenalidomide in combination with other agents like ixazomib or elotuzumab. But there was no difference in terms of maintenance treatment that these patients received. About the same proportion received the same drugs for the same duration. What was interesting in this trial is that although the complete remission or response rate was not significantly different, and also when we looked at MRD early on, within 100 days, that was not different, but we continued to see a trend in a longer progression-free survival in the Busulfan plus Melphalan arm. And at the completion of trial with more than 200 patients treated and now the follow-up approaching almost 2.5 years, we see significantly longer progression-free survival in the Busulfan plus Melphalan arm. At the latest analyses, we had about 64-month progression-free survival in the Bu-Mel arm versus 36 months in the Melphalan-only arm. Again, with longer follow-up, that may change, but the trend, which is statistically significant, persists in favor of Busulfan plus Melphalan. And we also looked at, did induction or maintenance have any impact? No. Regardless of induction or maintenance treatment, patients who receive Bu-Mel continue to show the benefit. And another very important thing about this study that we noted was that specifically in patients who had high-risk chromosomal abnormalities, and there were 30% in each group, and that included deletion 17, translocation 414. We also look at gain of chromosome 1. So specifically patients who had high-risk chromosomal abnormalities had longer progression-free survival in the Bu-Mel arm, again supporting that this regimen, either by targeting a myeloma stem cell or perhaps inducing a deeper remission if we had done those follow-up MRD assays at a later time point, leads to significant benefit in newly diagnosed multiple myeloma patients, including patients with high-risk disease. Of course, whenever we intensify a regimen, you always expect to see more side effects. And the trade-off is if that translates into greater benefit and the toxicities are not too horrific, then those are considered acceptable. So yes, in the two-drug arm, we saw more side effects and more toxicity. Again, whether you get Melphalan or Busulfan plus Melphalan, patients do become neutropenic. They require Neupogen. They require some blood or platelet transfusion. But what was difference between the two arms was that in the Bu-Mel arm, we saw more throat pain, and some what we call mucositis, which is the throat irritation and mouth soreness. We also saw more increase in some liver function tests, which were all transient and recovered spontaneously, but yes, it is a side effect, and more patients develop neutropenic fever in the Busulfan plus Melphalan arm. Also, the regimen is given over 6 days as opposed to just 1 day in the Melphalan arm. So yes, there were more side effects, but they were reversible. There was no significant difference. There were no deaths related to either of the regimen, either within 100 days or within a year. There was no significant difference between the two arms. And we also looked at the second primary malignancies, or SPM, and at the last follow-up, there were 2 in the Bu-Mel and 3 in the Melphalan arm. So that was also not significant. So yes, we did see some more toxicity in the Bu-Mel as we expected, but those were all reversible and patients fully recovered.